The case I brought to conference today is an 8-year-old female. Her name is Kelly. She was referred to us by her school social worker for anxiety that she's experiencing in school. Her mother reports that in the morning she doesn't want to go to school. She's experiencing nightmares and some psychosomatic symptoms in the form of stomach aches, headaches, fever. She's having great anxiety about getting on the bus, doesn't want to get on the bus. When questioned by her school social worker, she feels that no one wants to talk to her and she's not good at anything at school. The child appears to be both 8 years old in her chronological and developmental age, and she's up to date on all gross motor skills. She will play and run on the playground. However, she does not enjoy playing organized sports such as gym class and things like that. She feels that she's not doing well enough and that her fellow classmates don't want her to be on the team. She participates in all art classes and is able to draw and participate well in those things. It's a strength of hers. However, she's having a little bit of trouble writing her letters and her numbers, and she also states it as a point of anxiety in terms of creative writing and sharing papers, that she doesn't want her classmates to say, oh, mine isn't as good as hers, or things like that. Things at home have been difficult for Kelly lately. Her parents are recently separated. They're not quite divorced. However, her mother is in a relationship and has also gone back to work after years of being a stay-at-home mom. She became a stay-at-home mom when Kelly was born, and so this is the first time she's had her mom away from home. And she does not see her father as much as she would like to. There's some question if Dad is involved in another relationship or not. Mom's not really sure. And Dad was traveling for work when I called to ask if any questions about Kelly. He is to come to see us next week when he returns. Her socioeconomic status has also changed. They were a pretty upper middle class family. However, she and Mom have moved out into an apartment, and I would classify them more now as lower middle class. Mom has gone back to work in a professional occupation. However, she's at entry level since she hasn't been at work in the last 8 years. Her family is Caucasian and reside in the suburban area. She attends a public school there. And Sue did the mental status examination for me, so if you wouldn't mind reporting on that.
Sure thing. Kelly presented with a cooperative but somewhat reserved attitude. She appeared well-nourished and well-groomed and looked appropriate as being 8 years old. Her speech was quiet but relevant and coherent and appropriate for her age, and she was attentive and appropriate in her question and answer. Her eye contact was minimal, and she would look away quickly when she did look at me. She was oriented to person, place, and time. Her affect was quiet and shy. She hid behind her mother at first and spoke in a very soft voice. She said her tummy hurt, which I think is her manifestation of feeling nervous. She reported feeling nervous every day in the past 2 weeks. She reported feeling nervous when she gets ready for school, or when her teacher calls on her, or when the other kids are watching her. And the being watched appeared to me to be a feeling of, normal times when the teacher calls on her, not as a manifestation of paranoia. The mother reported no known use of drugs or alcohol by the child, but the mother did report occasional excessive drinking by the father and no drug use by either parent. Kelly denied obsessions, compulsions, delusions, and hallucinations, and the mother denied any evidence of those. She denied suicidal or homicidal ideation, and the mother has not observed any extreme aggression or self-harming behavior. She reported no trouble falling asleep at night or waking up in the morning, and the mother reported the same thing. According to the mother, her affect and behavior at this interview was typical for her normal behavior, and I perceived her to be pleasant but somewhat nervous. And these characteristics didn't seem excessive, but it's something that could begin to become into excessive and overwhelming anxiety, so it would be good to teach her some coping skills.
One thing I would like to do, if it's all right with the rest of the treatment team, is we haven't had an opportunity to speak to Dad yet, and I don't have a very clear picture of what's going on in terms of a global family sense. So if we could take this time, since she's been referred by the school, to really focus on Kelly and some of the things that we can do to help her with the school things, and then maybe next week when we meet again, after I've had a chance to speak with Dad, bring in some things about the family, I think that would serve her best and serve our time best. Does that work for everybody here?
That makes sense.
Okay, okay, great. So let's start looking at what we have in terms of school. anxious about getting on the bus, anxious about going, psychosomatic symptoms, reports being anxious in the mental status exam when teachers calling on her. So I'm open. What do we have for some ideas?
Do we want to address the bus, getting on the bus as one of our, we can do some real concrete things with that and measurable as far as planning how many days a week she's going to get on the bus, and we can teach her some skills for how.
Yeah, so maybe give her, say if you could get on the bus 2 days between now and our next session, maybe give her some, skills.
You think that's reasonable to ask her for 2 days in the next week to get on the bus? Has her mom been taking her to school? Is that?
Yeah, Mom has been driving her. They've been going out to the bus stop every morning, and they've been prepping to get on the bus. And Mom did say that Kelly got to the bus door this last week, which has been a big step from where she was. When they first started that 2 weeks ago, when they first made the phone call before they came to see us, Mom had decided to start taking her out. And when she did that, she's gone from not being able to get off the porch to actually getting to the bus. So I think we're in that right step.
Starting to make some progress.
Yeah, so I don't know if maybe, what do you guys think of scaling it down to 1 day first, see if we can do it 1 day, or do we want to try to work for 2?
What about talking to Kelly about what she thinks she might be able to manage?
Yeah,
That's a great
let her
idea.
help us set or help you set the objective.
That's a great idea. So we'll leave the date open between 1 and 2, but make an objective for her to get on the bus 1 day this week?
Yeah.
Or 4 days this week?
So what are we gonna? Oh, sorry. What are we gonna do to help her? Give her some techniques. To
I
get on
actually
the
have
bus?
an idea.
Yeah.
I used a strategy with a little girl who was about Kelly's age that worked really well. It helped her kind of externalize the anxiety. And what we did was we created worry bugs, things that she was really stressed out about.
Okay.
And then she could draw a picture on the worry bug of whatever it was that she was concerned about, or write a sentence. And then she could take the worry bug and put it in a bug house, close the lid, and leave it behind, and then move on without her worry. So she's taken the worry out, she's put it away, and with Kelly loving art, she would
That's
probably
exactly
really
what I was
enjoy
thinking,
building a bug box or something.
Yeah, she make a box or a
And
jar.
that's
Yeah.
something she and Mom could do together, which I think is really important. I know we're not getting a lot in the family, but I think having something special like that with Mom would be a really great thing. Also something that could be able to travel to Dad's house. It's a great
That's
idea.
Oh, yeah, that's
It's a
right.
great
We can go
idea.
with her.
Do you have a template of the bugs you used, or did you just freeform have her draw them?
I just did freeform.
Okay, great. We can do that. That would be
That's
great.
good. So that's one really
I
good
think that
technique
we
can
can
use
use that. That's wonderful. So use that as our medium in trying to help her through that. And I think she can use that in some of the other things she's experiencing too.
Absolutely.
It would probably also help if she could kind of label how anxious she is getting on the bus,
Or
like
like
some
a
sort of,
scale.
yeah. Like you want to make it something that a child would be able to relate to.
Right, I don't think she would really get the 1 to 10
Right.
kind of thing.
Right.
I know I've used before in terms of, we've used food in terms of what kind of ice cream do you really like, what kind of ice cream do you sort of like, what kind of ice cream do you not like at all, and where does this fall in your ice cream likes. It's worked well with a child around this age, and I think Kelly would respond to that as well. It also might give Mom some incentive to do some ice cream later too, which I know is something she could use again.
A little reward.
Or even staying with the bug theme and going with butterflies,
Yeah, didn't you do that once before?
Butterflies.
Butterflies in your tummy?
Butterflies in your tummy, not like that, but we could do something like
Like how
that
many
too.
butterflies are there? Like if it's 1, you feel okay, you can get on the bus. If it's 5, it's like you don't want to even see the bus.
Right.
The tummy has reached
And the tummy-
maximum
yeah,
capacity.
that's
We're fluttering away.
That's right.